Shock delivered, continue CPR. 1 milligram of epinephrine. Good compressions. Okay, it's been 2 minutes, let's shock again.
This is a great day for the Faculty of Medicine and Interior Health. We are here to officially open the Pritchard Simulation Center, our own new human patient simulation center. The Pritchard Simulation Center is going to be a wonderful addition to our medical education armamentarium. Our students will be able to practice procedures, examination of patients, treatment of acute illness in the safety of a simulation center rather than on a live patient where there could be harm done.
We had purchased equipment from time to time for the hospital. But 3 years ago, when it was announced that we were going to have a new and expanded cardiology department, I thought it might be nice to provide some equipment for that department.
It changes the intensity depending on where I'm listening.
Well, I'm a graduate of UBC, more than half a century ago, and I was delighted to see UBC establish a campus here in the Okanagan. And I'm particularly delighted to see them have a medical school here in the Okanagan. At my age, you recognize how important healthcare is, and I would like to and happy to support anything that advances medical care and treatment in the Okanagan.
It's much more difficult now to go into hospital and examine patients when they are so sick. It is much safer for them to have us practice on simulators prior to visiting them in hospital. So for our students, especially in their first 2 years where they're just learning how to handle patients in general, this is great for them. The Harvey simulator is primarily a cardiopulmonary type patient. The simulator offers a lot of different heart murmurs and cardiac findings that what might be difficult for a student to experience in the hospital nowadays. So it does add another arm to their learning. The SimMan G3 is a more critical care type intervention. So patients who might be having a heart attack, who might be actually vomiting blood, who are going into shock. There's a number of conditions that can be programmed into that computer that would allow students to practice. It's also a wonderful simulator for team training. So when nurses and doctors caught in an acute care setting where they all have to work to the patient's benefit, for them to work as a team can be practiced in this setting.
What did Winston Churchill say? We live by what we get, but we make a life by what we give. And that's true today.